With the leg straight, Thompson's test is applied by squeezing the calf. If the foot fails to plantarflex, this is an indication of a ruptured Achilles tendon. This is not always visible due to gross swelling in the area. Standing tests are done to establish functional ability, starting with the ability to walk on tiptoes, walk on their heels, inversion stress, pushing up on both feet, and then 1 foot at a time, looking for pain and differences in strength. Finally, to check out the patient's proprioception, the patient is asked to balance on 1 foot at a time for about 10 seconds. And then to repeat action with the eyes closed. Balance will be difficult to maintain if proprioception is poor. On completion of these tests, the therapist should be able to determine the injury site or functional problem. The common injuries to the lower leg are as follows: fractures to the tibia, fibula and foot bones, which generally means immobilization and consequent lengthy rehabilitation. The soft tissue problems are overuse conditions such as shin splints, which is a name covering several conditions of pain in the lower leg. Stress fractures, which are minute cracks in the bone, occur at places along the fibula, tibia and metatarsals of the foot. Compartment syndromes, the most common being the anterior compartment, the lateral compartment and the deep and superficial posterior compartments, are areas where the muscles inside their respective sheaths hypertrophy too quickly due to overtraining. The sheaths become too tight and prevent normal blood flow to the muscles' requirements, causing a gradual build-up of pain. The remaining shin splint problem is called periostitis, which generally occurs in the lower 2/3 of the tibial border. This happens due to the muscles and their connective tissues being stressed on constant impact activities, such as running and jumping, with inadequate shock absorption or because of foot faults. This causes the tissues to put excessive stress on their periosteal attachments, with consequent tearing and inflammation. The sole of the foot presents injuries such as calcaneal spurs, plantar fasciitis, and metatarsalgia. The most common injuries of all are ligament sprains, the lateral talofibular ligament being the most commonly injured, the calcaneofibular ligament, and on the medial side, the deltoid ligaments. Moving to the back of the leg, the calf muscles are subject to strains occurring in the muscle belly or the muscular tendinous junction. The Achilles tendon can be ruptured or partially ruptured or present with various forms of tendinitis. Bursitis or traction periostitis can occur at the tendocalcaneal insertion. Other injuries are metatarsal problems or stresses to the joints of the toes.